Assalamu alaikum. Hello, dear friends. This is one of a series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it, and the responsible person for each step. We can update these rules when we have new standards to follow. In this video, we will talk about the policy of dietary requirements and menu. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with follow and likes. This policy is applied to nutrition department and all dietary services in our hospital. The purpose of this policy are: 1. To provide meals that conform the social and cultural frame, religious practices, and traditions of the patients. 2. To provide adequate food choices for patients whose needs are not met by the standard menu. 3. To ensure that meals conform the dietary needs and eating habits of patients according to age group. 4. To provide an optimal nutritional care through serving well-balanced and nutritious meals to the patients as required by their medical and nutritional conditions. And 5. To meet standards of responsibility for monitoring and preventing potential drug nutritional interaction with pharmacists and dietitian. Definition: diet requirements and menu development. It's the planned sets of menu for regular and therapeutic diets. Policy statement. Number 1. The recommended daily allowance as set by the Food and Nutrition Board of the National Research Council will be used as a guide in determining required daily intake of particular nutrients. Number 2. The food guide pyramid and food exchange list are followed for menu planning and development. Number 3. Menus are prepared by the dietitian in collaboration with the chief cook and upon the approval of the catering manager. It's standardized menu intended for regular diet and modified for therapeutic purposes. Number 4. Foods appropriate for the patient's age, cultural, dietary preferences, medical condition, or needs and allergies are prepared and available at regular times. Number 5. A separate regional or continental menu are provided for non-Arab nationalities. Number 6. Menus of the day are adjusted according to patients' food preferences, food allergy, and food intolerance to acquire menu accuracy. Number 7. The approved hospital manual of nutritionists and clinical dietetics is the guide for modified diets ordered by the physicians and the nutritionists. Number 8. It's important for dietitians and pharmacists to assess the drug regimen in light of the nutritional status and intake of the patient and to recommend appropriate diet changes or nutritional supplements. Procedures. Number one, assess patient's nutritional status. Number two, if necessary, discuss with pharmacist when the patient's assessment indicates possible food-drug interaction. Number three, monitor patient's compliance to the diet. Number four, counsel patient or family and provide educational materials if treatment will continue at home. Number five, document patient's education and counseling in the medical record. Number six, therapeutic menus are modified versions of regular menus which include A. Diabetic diets based on the food exchange list produced by the American Diabetic Association and by the American Dietetic Association. Responsible person, nutritionist, and dietitian. B. Renal diets based on the food exchange list produced by the American Kidney Foundation and by the American Dietetic Association. C. Therapeutic diets follows the accepted standards as indicated in the current literature in diet manual and based on the food guide pyramid and food exchange list produced by the American Dietetic Association. For example, fat restricted, fiber restricted, high fiber, tyramine restricted, and purine restricted diets. D. Modified mineral diet follows the accepted standards as indicated in the current literature in diet manual and based on the recommended daily allowance as set by the Food and Nutrition Board of the National Research Council as a guide. For example, sodium restricted, potassium modified, ferrous rich, and calcium rich diets. E. Modified consistency diets follows the accepted standards as indicated in the Manual of Nutritional and Clinical Dietetics and based on the food exchange list produced by the American Dietetic Association. For example, full liquid, clear liquid, and soft diet. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Thank you.